Hello, it's Thursday the 26th of March. My name's Matthew Rogers and I'm Head of Professional Development for the Institute of Osteopathy. We now have over 1,000 osteopaths contributing to this forum, Let's Talk Osteopathy. So thank you so much for all your questions and inquiries. We're going to do our best to get through all of them. Please bear with us. The most common question that we're getting through at the moment is how do we as osteopaths contribute to the NHS and support our NHS colleagues at this very difficult time. So I thought I'd summarise some of the options available to us. I did speak to Beverly Harden yesterday on the phone. She's the lead allied health professional for Health Education England, which is the organisation that's coordinating the workforce supply issue at the moment. And she wanted me to pass on her heartfelt thanks for the hundreds of applications they've received from osteopaths. They're a bit overwhelmed at the moment. They are trying to get through everyone one by one. So they have asked that we bear with them and we're patient at this time, but she wanted to say a huge thank you and that she truly believes that osteopaths have a critical role to play in the fight against COVID-19. There are several options that you can use if you are interested in trying to support the NHS, and the links for all of those will be on our frequently asked questions section of our website, so go there for the links. The first you may be aware about is that Health Education England, HEE, has put a survey together that you can use to express your interest. Some colleagues have been suggesting they have noticed that it does say what's your previous NHS experience. They've been asking if that's a barrier. I spoke to Beverly and she said it's not a barrier. Obviously, if you do have previous NHS experience, it helps them to deploy you most appropriately. But if you don't, fill it in anyway and they will get back to you. I spoke to an osteopath at 9 o'clock last night and she said that she has a phone interview with them today. So they are calling osteopaths up via that mechanism. Another mechanism that will soon be live is the link to the bank locum staff, the bank that they can use as and when they need it. There have been concerns that when it asks your registration, the only option is HCPC. I spoke to Beverly Harden about that and she said that was intentional. At the moment, they are getting hundreds of calls in and expressions of interest every hour, and they need to prioritise somewhere. So the first priority is urgent response teams and those with experience in acute care like A&E, so they have to start somewhere. But over the next few days, they will be opening that out to other allied health professionals as well. So she asked that we bear with them and keep checking back regularly via that mechanism. Another mechanism is to go via the standard NHS recruitment pathway, which is the NHS Jobs website, www.jobs.nhs.uk. If you search for COVID-19, all the jobs relating to the virus will come up there. There may not be anything in your area at the moment, but keep checking back. Obviously, something they're desperate for is NHS 111 call operators. So that is an opportunity to keep people out of A&E, out of emergency care, and give them the information they need. It's a really important way of taking the pressure off of NHS colleagues. You can work from home for the most part, and it's a really important role. So they're desperate for that. Please think about signing up to that. There are also lots of voluntary roles at the moment. They are looking for people with experience of teaching to volunteer to train staff at NHS Nightingale. So that is another mechanism you might consider. Something that I really need to make clear at this stage: they are not looking for any clinicians to work in their normal mechanism within the NHS at the moment. They're recruiting orthopaedic surgeons to work as basic medics in A&E. They're portering physiotherapists across to nursing duties in the respiratory wards, and they will not be looking for osteopaths to act as osteopaths at this time. They're not looking to backfill MSK units. Those are all closing at the moment. So what they really need is a number of enthusiastic and motivated clinicians to do whatever it takes to support our NHS colleagues at this very difficult time. So please bear that in mind when you're filling in your application forms, because that will make the process quicker. What are the transferable skills that you have that might be of use to them? What admin experience do you have? What logistical experience do you have? Please put that on your application because it will help them to decide where to mobilise you to. At this very difficult time, when many of us are taking the extremely difficult decision to close our clinics, we still have a vital role to play in supporting in the fight against COVID-19. So let's work together to get through this together. we've got this osteopathy.